they finally come to the end. But as I tell you this morning, we want them all district they can go find the training materials them for the district. Each district will go with that. And we also say we want to do the community training, the community health training for Wednesday and Thursday.
Couche and good evening, everyone. This is Jon Lascher from Partners in Health, Sierra Leone. Today is Saturday, April 25th. Since our last audio update on Thursday, there have been 22 new confirmed coronavirus cases in the country, bringing the total number of cases up to 86. On Friday, yesterday, there were 18 new cases, and this was the highest number of new cases confirmed in the country since the outbreak began in late March. Today was the final day of the training of trainers for the National Contact Tracing Program. I was able to catch up with Gbessay Saffa, who is leading the contact tracing effort for the Government of Sierra Leone, to hear a little bit about the partnership with PIH and what his hopes for the future of contact tracing are for this epidemic. I hope everyone is having a great weekend, and we'll be back with you next week with more audio updates.
Yes, good morning. My name is Gbessay Saffa. I am the coordinator for contact tracing in Sierra Leone, national coordinator.
How long have you been the national coordinator for contact tracing?
Since the beginning of the outbreak of COVID-19, but before that I was a surveillance officer in Bo. I was also the head of surveillance in Bo district, and I acted as coordinator for contact tracing during the outbreak of Ebola. So I was transferred to Freetown, and I've been here for the last 6 months.
What was contact tracing like in Bo during the Ebola outbreak?
Yeah, it was very helpful because during that time we were able to track all those who had contacted a confirmed or probable case in Bo district, and we were able to follow them up for 21 days, and most of them were okay during that period, and some actually developed symptoms, and we were able to track them. And, that prevented the spread of the disease in many ways. Some communities were called off, and we were able to contain the outbreak successfully.
How many contact tracers were there in Bo during the Ebola outbreak?
We had so many contacts, and so we trained a whole lot of them. And later on, UNFP actually took the responsibility to do contact tracing. But the Ministry of Health, we had 1,100 contact tracers in the entire city, in the entire district. Yeah.
Can you tell us a little bit about what the contact tracing plan for coronavirus is?
Yeah, so one of the ways to interrupt the chain of transmission and to slow down the pandemic is contact tracing. And it is simply the act of identifying those who have touched or contacted a confirmed or probable case, and also line list the contacts. Line listing means you have to list all the people, and then you have the variables like the age, sex, address, contact numbers, for example, and then you follow them up, you check on them every day for 14 days. With this, you can prevent new hotspots, new outbreaks popping up in other districts. And currently, we have more cases in Freetown, and we have actually cases in some districts, like three different districts. We have in Freetown, we have in Tonkolili, we have in Potloko and Kenema district. So doing contact tracing can prevent people contact, those who have touched, from moving from one location to the other, thereby preventing, the spread or slowing down the spread of the disease.
So right now, how many contact tracers exist in Sierra Leone?
In Sierra Leone, I can talk about Freetown, where we have trained over 500 contact tracers. And in the provinces, we are about to train 110 each for each district, supported by PIH. So we have just finished the training for TOT, that is training of trainers, for the 14 districts, that has not got contact tracers yet. So they will be going to, to train those people in their respective districts.
How have you seen the response for coronavirus compared to the response to Ebola?
The response in terms of coronavirus is similar to Ebola, but there are differences in the sense that the coronavirus is very, very fast in moving in terms of, infecting people. It's the incubation period, of course, is 14 days. And the other difference that it has with Ebola is the fact that people get infection and we emit or we transfer or transmit the infection from one to the other, even without showing symptoms. That is the key difference between Ebola and Corona. And the third one is the mortality rate is a bit better. Because as it is, we've got almost 10 survivors, which is not the case of Ebola. Ebola was very little. That's the difference.
Could you talk a little bit about just the work with Partners in Health over the last couple of weeks?
So Partners in Health is one of the partners we have supporting the contact tracing activities in Sierra Leone. And they have been very instrumental in terms of developing our strategic plans, the SOP standard operational procedures, and even the materials we use to train contact tracers. So basically, they have supported the training of over 42 individuals from the districts, 14 districts. We actually targeted the CHW community health workers focal person, the surveillance officer, and the IPC focal, 3 from each district. So a total of 42 people at least were trained, supported by PIH, and we also, plan with them for them to support a cascade training of 110 contact tracers for each district, in which 100 of them will be community health workers and 10 will be their peer supervisors. And we are expecting that for each 10 contact tracers, they will get 1 peer supervisor to supervise their activities. And all of these, we are going to do it in collaboration with PIH. They have been very instrumental in that.
Thank you very much.
Thank you. Thank you.